Hi, it's the nursing professor here. We are continuing on our road to successfully completing our final exams. And so today we're actually going to talk about maternity, OB, women's health. All right. So there's 6 concepts that we're going to go over. Normal pregnancy lasts anywhere between 37 and 42 weeks. Really, we like it around 38 to 40 weeks, but that is the span of time. Prior to 37 weeks is usually considered preterm labor. After 40 weeks, depending on the size and health of the baby, baby gets too big. It's time for that baby to come out. So there are 4 stages of labor. This is concept number 1, 4 stages of labor. First stage is the latent stage, where you have the dilation of the cervix 0 to 3 centimeters. The active stage of that is 4 to 7 centimeters. And the transition phase is anywhere from 8 to 10 centimeters. So those are the 3 parts of the first stage of labor. Second stage of labor is delivery of the baby. Third stage of labor is delivery of the placenta. Fourth stage of labor is recovery for both baby and mom. All right. Number 2 concept is the fetal heart monitoring. Now, normal fetal heart monitoring is between 110 and 160 beats per minute. When we see accelerations, it's reassuring. This baby is active, they're responding, that's appropriate. But at times when we see late decelerations, we get concerned because we need that baby to be more stimulated. And so those are often the patterns that are looked upon to determine if that baby needs to be immediately delivered or not. Okay? Third stage is Leopold's maneuvers. This is where you're actually doing an assessment. You're putting your hands on the patient's belly and you're determining the position of the baby, how it is going to present. Is the head down? Is the cervix starting to open there? Is it engaged in that canal? Those are the things that are assessed with Leopold's maneuver. Now, if we notice that there's any problems with how that baby is positioned, or if there's any deceleration of heart rate, then again, the physician should be called. All right, number 4 concept is preterm labor and warning signs. Sometimes these babies want to come early. And so signs of preterm labor includes regular contractions before 37 weeks and cervical changes. So not only is the mom having contractions, but the cervix is starting to open. So there are interventions that we can do to help slow that down. We don't necessarily want to stop it all the way if, things are progressing, unless it's early in the term of the pregnancy, but we want to slow it down. And so there's various tocolytics that can be used, and those are medications that will help slow down those contractions and just suppress them so that the baby can stay in for a longer period of time. Hydration, bed rest are also interventions that we can use. Now, those tocolytics can be several different drugs. They could be calcium channel blockers. They could be indomethacin, which is really NSAID, the beta agonist, like terbutaline can also be used in order to relax that uterus. Now, I'm coming back to my pharmacology book here by RN Essentials. Now, trust me, I don't know this person, but this book is so doggone good in that even when you come here and you're talking about the maternity drugs, this is primarily the only place that you're going to need to know certain of these drugs. You come here, you can see the OB medications are listed there, and she starts out talking about those tocolytics. And so this, again, just super, super duper good. So check it out on rnessentials.org. Great tool, especially as you are studying for your maternity final and for NCLEX. All right, so where were we? Number 5 concept is the postpartum assessment. Baby has been born either vaginally or by C-section. And the assessment tool or acronym that you can remember is called BUBBLE-HE. B stands for breast, U stands for uterus, B stands for bladder, B stands for bowels, L stands for lochia, E stands for episiotomy, H stands for Homan sign, and E stands for emotional. So the acronym again is BUBBLE-HE, and those are all the things that you're going to assess. Very important that at this time that you get a lactation specialist to see your patient to make sure that the baby is latching on appropriately, that there's no engorgement, that mom can feed every 2 to 3 hours for this newborn, and give the person all the techniques and tricks in order to make that happen. Because with some babies, it's not just, automatic, regardless of what they say. All right, now, number 6 concept. These are complications that we need to be aware of, and these things can be quite serious. So preeclampsia and eclampsia, the difference between the two is in preeclampsia, person has hypertension, they can have proteinuria and edema, body gets really swollen. Eclampsia is when you have that hypertension and at risk for seizures. So the blood pressure is up really, really high. And so you should know the difference between the two. You should know what interventions you would do with the eclampsia, knowing that seizures could be impending. You want to make sure you have an airway at that bedside. You're going to look at ABCs. Put your person on the left lateral side. That's always the answer. What position? Left lateral side. Mag sulfate is also the drug of choice. All right. Now, severe preeclampsia means that baby needs to come out of there. All right, so it needs to be delivered. The person's given antihypertensives like labetalol, hydralazine, nifedipine, and baby is delivered. Other OB emergencies include shoulder dystocia. Sometimes those shoulders get stuck in there and they have to be manipulated, and the baby could end up with some trauma there. Also, cord prolapse. The umbilical cord can wrap around that baby's neck or even around a limb. Last but not least is RH incompatibility. With some moms, they could be RH negative, but the baby could be RH positive. That doesn't mix. And so around week number 28, they get Rogram, and then again, they get that right after delivery within 72 hours. But if the baby is RH negative and mom is RH negative, then there's no intervention that needs to be done because that is compatible. So I hope that helps. Good luck on your exam. Let me know how you do, and make sure you like and share this final review. And I will see you next video. Bye for now.